Thank you, madam. And I would, at the outset, like to thank the department for inviting me here to speak about the physician burnout. This is a topic which is usually not discussed. So I do not have any conflict of interest when I'm speaking on this topic, but I'll be using some of the images from the Google just to convey some of the messages. And if you want to get the references for the presentation, you're most welcome that you can get it from me. So when we look at how the world perceives doctors, what should be the traits of the doctors? So we are considered to be having the highest level of morality, dedication, and whatever is expected in the world from an ideal person, it is expected from the doctors. However, the two most important things here to understand that we should be having the traits that we should genuinely care for our patients and have a lot of empathy in our communication and interaction with our patient and people around. So with this background, let's look at a case Vignette. A 50-year-old doctor working in a government setup starts his outpatient at about 9:30, sees about 65 patients directly and also supervises his senior resident's work. About 5 patients is being shown by the senior resident to him and about sees 6 patients being shown by the junior resident. However, while providing the services, he gets irritable on small matters, shouts at his residents for being incompetent, gets irritable. If patient asks for something extra information or questions, he passes sarcastic comments to the patient and their caregivers. Later, while talking to his colleagues, he would frequently report that the system is faulty and rotten and nothing is going to improve. Now, this is something, how many of you have not faced while working in PGI? That's the question which I'm asking to the students or to my colleagues, that how often do you introspect that possibly you end up behaving in this way? Yeah, any answers to this? Yes? So we are working in an ideal condition? I don't think so. So this is where we need to understand that this is a common scenario in most of the chambers of the doctors. And why this occurs? And if you try to understand what is the doctor going through, this is what we need to understand, is he's going through a physician burnout. Now, we try to understand physician burnout, so basically we understand that this is basically the term burnout here is used as a metaphor. And why it is used as a metaphor, let's try to understand that when a toy's battery run out, it stops working, isn't it? When a toy's battery will run out, it's not going to run anymore unless you change the battery. But what happens when a doctor's batteries run out? Do they ever stop working? The answer is definitely no. And that's why that all of you have gone through your 10+2 preparation for NEET and then gone to become a MBBS graduate, and you're here as a postgraduate, and some of them have gone beyond this. So all of us keeps on going through burnout, and so burnout occurs in every phase of medical career, and it's not just limited to the medical professionals. We all go through this. So what happens that when you keep on working as a dysfunctional person rather than stopping to work, that is basically the understanding of a physician burnout. So similarly, if you look at what happens when the car's fuel go away, it will stop working, but doctors don't stop working. So if you try to define burnout, it's the simpler way to define it is as it's an erosion of human soul. In short, the doctor himself is not happy. And we try to define it broadly, or the basic definition of burnout is it's a persistent negative work-related state of mind in a normal individual. When I say normal individual, basically here we are trying to distinguish it from a person with any kind of a mental illness, and that is primarily characterized by exhaustion, which is accompanied by distress and a sense of reduced effectiveness, decreased motivation, and development of a dysfunctional attitude and behavior at work. So that is where we try to understand the burnout. And there are three basic components of burnout. One is the emotional exhaustion, depersonalization, and a sense of low personal accomplishment. So all these three contribute to the decreased effectiveness at work, and not necessary that these are some kind of stages of burnout, but not necessary that they occur in a sequence. They can occur in any format, and a person may have a difficulty in one domain or can have difficulty in all the domains. So how do we understand the exhaustion? So it is basically at physical and emotional energy levels that are extremely low and are in a downward spiral. And a common thought process is, I'm not sure how long I can keep on going like this. So somebody who's working in the OPD right from the morning till the evening every day, or thrice a week or 4 times a week, and then is involved in emergency care or somewhere. So the feeling is that how long I can carry on with this and how things are going to move. The deeper personalization is basically understood as a compassion fatigue. So at this stage, the doctors themselves are not emotionally available to their patient or anyone else to that matter. And emotional energy is understood as some kind of a dry energy, that you are not emotionally able to connect with anybody. And this is basically signaled by a lot of cynicism, sarcasm, and the need to vent out about your patients or about your job. So you become more of a cynical person. So what do we understand by cynicism? That you have lost the ability to care, empathize, and connect with the patient, staff, and the co-workers. And you even end up blaming, shaming, or demonizing the people whom you are charged of caring for. And you also start feeling guilty about the same later on. So that is where we need to understand, that's where the whole cynicism comes in. And the lack of efficacy or sense of lack of personal accomplishment, that the person himself begins to doubt the meaning or about the quality of their own work, and they may start thinking like, what's the use? My work doesn't really serve a purpose anymore, and may worry about making mistakes if things don't get better soon. So that's where the whole sense of lack of personal accomplishment comes in. So this is basically how we understand burnout. So who develops it? All levels of medical professionals are at a risk, and starting from the people those are studying medical students, that is the MBBS students, interns, residents, fellows, junior staff, senior staff, and everybody. However, it is more often seen in frontline healthcare workers who are at a greater risk, those working in the internal medicine, especially those in the emergency setting. So if we look at this, what is the outcome of burnout? Who all get affected? It's not the physician who is himself suffering. Because a physician is suffering, so the patient is suffering, the family members or the caregivers of the patients are suffering, their relationships, that is the relationship of the physician with his colleagues, with his family, with his patient is suffering, and of course their families also suffer, and often their colleagues who are working with them, who are junior, who cannot voice things to a physician who is burnt out, may be suffering. So how common it is? So it is understood that 54% of the doctors say that they are burnt out. This is a survey from US, and they about almost all, if I say 84%, say that they are stressed out. But one of the marker which is being taken as how much are you going to recommend the profession. So about 60% of the doctors say that they are not going to recommend their children to take medicine as the career. So that's where we need to understand how much the doctors are getting affected. And to simply say, is it increasing over time? So again, a survey from US which compared the data or longitudinally followed up the doctors from 2011 to 14 suggests that there was about 10% increase in the rate of burnout over the period of 3 years. So that is again understandable that these things are increasing very fast. Now, if you look at the data coming from US again, so as I've said that there is increase in the prevalence, and in terms of satisfaction with work-life balance, again you see that satisfaction with work-life balance is going down. And if you compare with general US population, the prevalence rate of burnout is higher among the physicians, and dissatisfaction with the work is again higher in physicians compared to those with other professions. So that's where we need to understand there's a basic difference how the doctors are themselves suffering. And in terms of career, there are different kind of differences or the image which we have for the early career physicians and those who in the middle level of career. So the early career, basically those who are in less than 10 years of their practice, who may be residents or other, they have lower satisfaction with overall career choice. They have higher frequency of work-home conflicts and higher rates of depersonalization. Whereas those who have moved further in their career, they more complain about working for long hours, and they are more dissatisfied with taking the overnight calls, and they have lower satisfaction with the specialty of their choice which they have taken, and they also complain of the work-life balance issues, and they have more emotional exhaustion and burnout rather than just the depersonalization. And when the data of US is compared with other countries, again the rates are possibly higher in US. So, and then if you look at the differences between the men and women, you will see that almost the rates are comparable in the early and the middle career professionals, but in the later part, females report more burnout compared to men. And when we look at the primary care, the surgical specialties, internal medicine and others, again, if you look at this, the primary care physician usually will have more burnout compared to the specialist. And in terms of private practice and the academic practice, again, those who are in private practice will usually have more burnout compared to those who are in the academic setup. So if we all are having this feeling of burnout, we can understand what our colleagues who are in the private sector may be going through. In terms of specialty, if you look at that, the highest, if you look at the percentage in terms of burnout, highest level of burnout is reported in those working in the emergency setting. And if you look at the level of dissatisfaction with the work-life balance, or the percentage satisfied with their work-life balance, again, you will see that neurosurgeons have the lowest level of satisfaction in terms of work-life balance. So that is where you need to understand it varies from specialty to specialty, and here is your specialty where you stand, but I understand many of you are working in emergency setting, and some of your subspecialties may not be reported here, but pediatric subspecialty again have lower level of satisfaction, but burnout rates are comparable to many of the other specialties. How common is burnout in Indian setting? Again, we have studies from different parts of the country, and different instruments have been used to assess burnout, but these data generally suggest there is high level of stress and burnout. We have a meta-analysis coming for the Indian data, and this basically suggests that in the 15 studies which were included in this meta-analysis, the rate of emotional exhaustion is about 24%, and depersonalization is 27%, and our personal accomplishment dysfunction is about 23%. And who are more at risk, as per the Indian data suggest, those who are young, females, who are unmarried, and are working in a difficult working condition, they are at a higher risk of burnout. What are the basic drivers of burnout in physicians? We need to understand that basically the conditioning in our medical profession is such that we need to be working hard, we should be perfectionists. If things are required, you should be available for your patient, you should do everything, and so on and so forth. So never show your weakness and so forth. So that's one of the major reasons that how medical profession works leads to burnout. Other things are the specific kind of jobs like on-call duties, but the so-called professional rivalries or the working conditions, which basically includes the local politics or the personality clashes, or who is part of your team, who is not part of your team, and how things are happening. And if you are trying to have a personal life, that because if you want to have your personal goals and personal achievements, so you have to spare time for that, and that's where a work-life conflict will start. And of course, at the end of the day, the leadership under which you are working makes a lot of difference. Sometimes you will see that you may have leaders or who are your supervisors, but they do not contribute to your learning, and they basically end up criticizing you, and sometimes and this happens because they are themselves unskilled or absent or they are themselves weak, they will not take decisions. So that's where we need to understand drives physician burnout. Other things we have all understood is the long working hours and the so-called work-related pressure which we all need to we face in day-to-day practice. And the so-called loss of meaning in medicine and patient care is gradually becoming more and more among physicians because of lack of support from the paraprofessionals, and more responsibility is being shifted to the doctors. But at the same time, you do not have autonomy or flexibility in taking your decisions or working in the conditions where you want to work. And there are a lot of institutional challenges which can also be contribute to physician burnout, that when you do not have the peer support, or people don't behave in a professional way with you, or the leadership does not take the decisions which they are required to take. So these will all drive to the burnout. And what are the risk factors? We need to understand that high level of work-life conflict, that this is the biggest driver if we try to understand that when you want to have your personal life and work life and you want to balance and we are not able to balance, that will drive you to the burnout. And work is often interrupted by the personal concerns, and there is high level of anger, loneliness, anxiety which is emerging. And you have relationship issues at the workplace, that you're not getting along. For example, you're working here, so as a junior resident, if you are not getting along well with your senior resident or with your consultant, or you have your thesis work, your seminar, case conference, and other things. So if you are not having a lot of relationship issues at the workplace, it will again lead to the burnout. Now, there are many people who are self-conscious and they want to perform well. So often they keep on evaluating themselves, although others may be saying that you're doing well. So when you often start having this own feeling that you always keep on questioning about your own competency, that's the personality trait which predisposes you to have more burnout. And again, when you are not able to unplug with your work, you have gone out of your work, you've done your shift, you reach home, but you're again thinking about your patient and keep calling up your colleagues, maybe juniors or seniors or batchmates, and asking what is happening with that patient. I've done this work, I've not done this work. Or you come back and do your work, so you're not able to unplug from your work. That again leads to burnout. Of course, regular use of alcohol and other drugs and sleep deprivation will again predispose you to the burnout. And as I've said, the data from the India and other parts of the world also suggests basically it is more common in young females, those who are not married and have long working hours and lack of job satisfaction. And what are the personality traits? Now, this is where we need to understand that actually simpler way to say is that those who take more responsibility of their work, who are more conscious of their work, those who want to perform well at work, those who are more committed to their work are actually more prone to burnout, because that's where because you have that tendency that you will give priority to the work than anything else, so that will lead to a lot of problems. So if we see a lot of our colleagues who are workaholic, working for long hours, they can sacrifice their personal life, which is understood as masochistic traits, for the work. That's where at the end of the day they are going to be at a higher risk of developing the burnout. And what are the organizational factors? When we say organizational factors, the institutional factors which contribute to that burnout. When you are exposed to the excessive workload, you are given the work which you are not supposed to do, or you're given a work which may not be falling in your domain, but you are expected to do. So that often increases the risk of burnout. And more time you spend in face-to-face interacting with the patients, documentation, or doing some kind of administrative work, you are at more higher risk of burnout. Of course, the long working hours and the frequency of on-call is again important. In the Western world, so-called the documentation in the electronic medical records is becoming a major issue, because you have to document everything on time and in the real time. So if you are not documenting things in the real time, and we are not far away from this, where we are talking about digitalization of medical records across the country, this is what is going to happen. And I was just talking to some of my colleagues, they say that, for example, somebody who's working in NHS as a primary care physician, you get about 5 minutes time to see a patient and enter everything in the electronic medical records. So everything done in 5 minutes. So we are not far away from this, and in many parts of the country this is already now being done. For example, when now Punjab is trying to employ people in Mohalla clinics, they are emphasizing the same fact. So So everybody will be scared when you're entering data if you miss out on anything. So all this will increase a lot of stress. And amount of time you spend at home once you go back again increases the risk, because whatever you carry home will increase your problems, and of course the risk of malpractice suits. So people, those who are working in private practice, that's a major concern from them. Again, a lot of differences are seen in those who are practicing in the urban and rural area, or the academic and non-academic centers, and the inpatient and the outpatient, or the emergency setting. So those who are working in the emergency setting face more burnout compared to those who are working in the outpatient setting. And those who are working in the urban and rural area, again, depending on the local politics and other things, influences the rate of burnout. But in general, it is in terms of academician and non-academician, people, those who are working in the private practice setting, especially corporate hospital, or running their own clinic, both as an administrator and clinician, they suffer from more burnout than what we suffer from. And in terms of patient characteristics, when you're dealing with a lot of demanding patients who talk about their entitlement, adherence, compliance, and other things, they will make the physician more at a risk. And when you have lack of control over your environment, that administration do not support, vis-a-vis you support the administration to run the hospital. So that's where you are at a higher risk, and I've already spoken about the leadership skills. So basically, if we look at the poor functioning of an institute, when a physician do not get sufficient rewards, have limited interpersonal collaboration or limited opportunities for advancement, and the institute do not provide them real life social support, they are at a much higher risk of burnout. So the major contributors are the overwhelming demands, social conflict at the workplace, lack of or loss of resources, insufficient reward, and absence of fairness. Now, absence of fairness is something which is being talked about, that if you are contributing in our institutional setup, we often jokingly discuss and say that the basic rule in PGI or in India is, जो काम करता है उसको और ज़्यादा दो, जो नहीं करता उसको कुछ मत बोलो. So that's the basic norm and dictum way in which we work, and that's something we talk about, lack of fairness. And although you keep on working too much, you're shouldering the responsibility of others, but you're still not rewarded. And people often say, again, if we try to understand the insufficient rewards or the things how work, again, one of the common dictum jokingly talked about when we are having a cup of coffee among us, is you show me the face, I'll tell you the rule. So that's where the things work, how the systems work. So that's where the whole problem arises, why people suffer from burnout. And we know these social conflicts or relationship problems which faculty have, and maybe everybody is threatened that if somebody else is progressing, it's not that I'm happy about his or her progress. I think that if he is progressing, my progress is going to stop, and we start having social interpersonal problems. So I'll just skip this part. Now, what are the factors? If you look at the Indian data further, what does Indian data suggest? This is mainly in relation to, the data comes mainly for the residents. So there is no difference across the medical and the surgical specialties. The factors which determine physician burnout mainly is the workload, lower chance of the recreational activities, higher verbal and physical abuse by the patient and the caregivers, and lack of empathy by the seniors. And of course, the residents suffer more burnout than the faculty. And in terms of residents, other factors which contribute to the burnout includes the unsatisfactory hostels, inadequate library facilities, frequent examinations, and excessive competitiveness among the students, and the so-called political conflict, jealousy, and the peer rivalry. This is what we all do, and we need to all learn to refrain from it, so that we can not only protect ourselves but also protect our colleagues. So in the private practice, again, what does the Indian data suggest? That although private practice will give you more control over your job style, but some people say it may be associated with lower burnout, but higher work engagement as a personality trait will always lead to the higher burnout. Now, what are the basic combinations, if you look at which will contribute to the burnout? That as a clinician, how much skills you have in terms of solving a problem, finding a meaning in your work, purpose, and practicing mindfulness, that will contribute to how much you are going to have burnout. And in terms of the external factors, in terms of modeling how your teachers or your colleagues are behaving with you, and your own internal attributes, the kind of person you are. So in terms of personal factors which can be protective or we can help you not to face burnout is the capacity to bounce back when you are facing a problem, how much you are able to withstand the hardship and are able to repair yourself and come back. If you are not able to do that, that is where you are going to have a problem. And when you have a positive attitude when you are facing stress or a disruptive change, for example, simple example, if as a resident you have been scolded by your faculty, you can take it in two different ways. That why I was scolded. Is it that I did not do my work? Is it because of my incompetency? Or you can say that the person is wrong, I am right. So it will totally depend on how you take it and how you manage things. Of course, if you have your own self-directedness and you are cooperative with others, you are able to deal with others in a better way, you have a less chance of having a burnout. And of course, that how much resilience you have, that you are able to face stress and you are able to manage, and the kind of emotional IQ we call as, or the emotional intelligence, that how you are able to perceive a situation, understand and manage your emotion in a particular situation. So more negativistic kind of attitude you are going to have more burnout. Of course, we need to improve the organizational functionalities, that we need to improve the internal communication systems to give right information to the right people so that then the systems work better. Because I was just talking to one of my colleagues who just came to show his child in PGIMER. So once he was seen by a clinician, he was sent to get certain investigations done. Who himself is working in a corporate hospital, he says that if I just write on the card, this investigation is to be done, or I just enter in the system, the patient, I'm now just waiting for the report to come. The patient will just need to reach the investigation site and everything will be done. But we all know how our patient and caregivers have to run and how much we have to struggle in all this. So there is no right information kind of a system. When that is not there, it will lead to more burnout. So we need to develop those kind of things. And individual satisfaction, that how much the system supports a person. When you join an institute or when you are working in an institute, the environment, the institute provides you what you want to do, how you want to progress, rather than institute asks you to do, this is what is you are supposed to do and just do this, don't think beyond this. So you stop creativity, you stop career development. So we need to understand that. And of course, the institute should provide us enough time to have a work-life balance, family time, that often helps. And for females, having kindergarten facilities or the crèche facilities in the hospital itself often helps or protects from the burnout. And again, for professional development, there should be all opportunities and the leadership should be a competent one. Now, burnout can occur in two ways, that somebody can have an acute precipitation of burnout. Especially this happens when you have a so-called traumatic kind of a event, like you've been bitten by a patient or there's a lawsuit and so on. Otherwise, all of us keep on going through burnout in a small step by step, and by suddenly then there's a precipitating factor and you develop the full-blown features of burnout. So initially, if you look at the stages of burnout, they have been described in different ways. But whenever we join a new place, we have this compulsion to prove ourselves that what we want to do, and you start pushing yourself very hard to do things and you start neglecting your personal needs. There's a lot of displacement of conflict, and there's a revision of your value system, what you believed or what you thought earlier about your self-worth and job starts changing, and gradually you start withdrawing from your social situations, and gradually you go on to develop the full-blown burnout syndrome. So the other way of describing it is that initially there's a lot of enthusiasm when you join a new place or you join the profession, but gradually you go through the whole phase of chronic stress, burnout, and then you become a habitual burnout person. That you do more think about it beyond that. So what are the consequences? You have lower level, that patient will have lower satisfaction and the quality of care you provide is low. There are high risk of medical errors and high risk of malpractice suits which you are going to face. And of course, people leave their jobs when they are working in a condition which leads to higher burnout kind of a phase. And there's a lot of friction in the personal relationships. And suddenly then you start isolating yourself from others and from your family members. So you become more and more lonely and don't interact with people. And of course, substance use is a very common outcome, and drug abuse. If you look at after the menial workers, those who are construction workers, doctors are the number 2 with respect to use of substances. That's where we stand. And there is high rate of suicide and the divorce among the doctors. And if you look at the suicide rates, they are more in women. The odds ratio is about 2.27 compared to the general population and 1.41 for the male physicians. So that's the other outcome of physician burnout. And basically, you go through the death spiral. When I say death spiral, as you more and more you are burnt out, more and more stress you are facing. We all understand these consequences of stress on the cardiovascular system and the endocrine system. And of course, you end up developing cardiovascular diseases and other things. And you are developing more and more physical morbidity. And this is something which clearly is depicted from the data from a survey which was done by IMA, which suggests that if we compare to the general population lifespan is about 72 years, whereas the doctors die at the age of 59. So that's where you're losing 13 years to serve the people. So we all need to understand that we need to be very careful in how we organize our work-life balance and how we should be behaving towards our work. Now, this is something which we need to understand. How do you recognize burnout among your colleagues, among people which you are working with? So somebody who suddenly starts disappearing, who was working well, who was very committed to his work, is now no more taking phone calls, is taking too many leaves, or there are unexplained absences at work. Or somebody who's coming late, who was always regular at work, but started coming late or taking frequent sick leaves. That's one of the indicator for burnout. Or somebody whose work performance gets slower, that he is not working at that particular speed at which he is expected to. So although to compensate that, he may be arriving late and going late, but still he is not able to achieve the workload which is being assigned to him or her. Of course, clinical rage, shouting at the patient, shouting at the colleague, shouting at your trainees is something which is which is a common manifestation of burnout. Then, by time more and more you proceed further in the burnout, you become more and more rigid. So you have poor tolerance for any kind of ambiguity or any kind of change, and you are not able to compromise, and you have a lot of difficulty in prioritizing things. And often you keep on complaining, so people recognize you as a whistleblower, that you're going to go and tell the administration that he's doing this, he's doing that, and so on, rather than focusing on your work. Again, a lot of bypass syndrome, when we all understand what is bypass. So basically, that when a junior colleagues, for example, a junior resident directly goes and starts talking to the consultant about the patient and bypasses the senior resident in between, or a senior resident bypasses the consultant in charge of the case or the unit in charge and directly goes and talks to the head of the department. That's again one of the sign of that he is not happy and he is not doing things. And again, people may start having problems in the exams or the academics, or they are not sure about the career choice and they want to leave medicine and they get disillusioned from the medicine. And of course, many of them will also have inside failure, means when I say that you try to criticize them for an academic thing or something that you want to tell that this is how you can improve your performance, they may take it negatively and start feeling that they have been victimized. So, or they start becoming a lot of defensive, or they start counter challenging. That's again an indicator that somebody is suffering from burnout. So the common complaints, those who come with burnout or talk about burnout when you are chatting with your colleagues at the coffee place or anywhere, somebody who says that he does not have control over his work environment, he lacks administrative support, and somebody talks about that he's not able to perform things which he's supposed to perform, that there are a lot of competing demands, and there's overall sense of futility in working. That's where you need to think that he requires help. So there could be more broader psychiatric manifestations, starting from loss of motivation to depression, anxiety, sleep disturbances, or basically feeling of helplessness, trapped or defeated, and so on. So, and in terms of physical form, that there is lower immunity, frequent infections, frequent health-related problems, headache, muscle all this should make us aware that am I experiencing burnout or not. We need to evaluate ourselves. Or when you start procrastinating at your work, you start refusing to take responsibilities, that's where you will feel that you are having a lot of burnout. So, is it same as depression? Definitely not. That burnout does not lead to a global impairment as we see in depression, but it primarily affects the work. And it is also not same as stress, because stress actually makes you get more engaged with your work and you start doing work you want to perform. But burnout, actually you start detaching from your work. So you start getting disengaged from your work. So it's not same as stress. And there are a lot of myths about burnout that we often all feel that it's not my problem, it's problem of somebody else. We should not be thinking from that perspective. And there are things that you feel that it's me only who have to change myself and do things, and I need to change. It's not that. Everybody goes through it. And burnout and depression is only affecting me. I'm only suffering, others are not suffering. That's also not true. And many people think that taking mental health care is not useful, it does not work, which is again a wrong notion. And people often decide about quitting, which is again is a common thing when we try to understand the burnout. When we talk about the prevention of physician burnout, we need to understand that we need to lower the stress levels and the drain which they are producing, and improve our abilities to recharge our energy account, which is basically understood as that we need to be performing like a competent person. So what should we be doing first? The first thing to do is learning to do a balance between work and life. We need to understand that we are humans, we need to have a life of our own, and disengage from work once you are off work. Unless you don't learn that, and you just keep on taking more and more responsibility of work and keep on extending your working hours because you have more responsibility. Many people start enjoying that you're working, and people are calling more and more for lectures, doing this, doing that. You're trying to do more research, you get more grants and everything. Somebody is asking you to do it. So that then you forget, in terms of that, you think that you're going to achieve a lot of things and people are recognizing you, and you start neglecting your life. That's something which we need to all refrain from at the faculty level and at the resident level. When I talk about the work-life balance, you need to understand that you may have long working hours, but when you're off work, try to have some hobbies, recreational activities, so that you can recharge yourself, spend time in your hobbies, so that once you come back to your work, you are fresh enough to move further. And when we try to talk about the prevention and management, because almost the same kind of strategies are being talked about prevention and management, we talk about the strategies at three levels, but one is the individual level, second is the modifying the organizational structure and the work process, and improving the fitness between the physician and the organization. So that's where we need to understand. In terms of the simple measures, when we try to understand at the individual levels, we all need to draw a boundary for ourselves which we are not going to cross, and we know how to start our work. Start your day with a relaxing ritual. I often go to a coffee room to start my day and talk to some of my colleagues, interact with them. That's my way of relaxing in the morning before I start my clinical work. And adopt healthy eating, exercising, and the sleeping habit. Set boundaries that how much you're going to do, how much you're not going to do. Take daily breaks from the technology, because this is something technology has actually, we just keep on checking our email and any professional information is coming, and so round the clock you are there. So preferably avoid doing that, and always look at your side which you think is a creative side, which you can use it for some other purpose other than the professional purpose, and learn to manage your stress. Then when we talk about the rest, we need to understand that we need to spend time with the family, have a personal physician to assess our well-being. When I say have a personal physician, at least you need to have a colleague with whom you can discuss issues and seek guidance depending on the kind of competency he or she has, and of course setting limits on hours and choosing certain type of medical practice which you are going to do, and being positive and maintaining a balance in life. Now, stress management techniques, again, we all understand that you can do different kind of relaxation or other stress management techniques to take care of your health, and whatever you prefer to do that. Of course, do not have friends, those who are workaholic. Although you may not be workaholic, but if you have too many workaholic friends, they will increase your anxiety and force you to become workaholic. So it's better always to keep away from them. And one of the best defense is a good offense. So do what you like, not that you are forced to do things, and like what you do. So basically, some of my colleagues say that when something which I don't consider work, and I am very comfortable in doing that. So learn to do that kind of a distinction, and always try to fight out if something is disrupting your work-life balance, and always look at the three things in life. The most important is the meaning, purpose, and worth it. That you may end up having 100 publications or 200 publications, but is it worth it? What you are doing for that? Running 10 extramural projects or 5 intramural projects and so on, or doing 10 things at a time, doing 4 OPDs in a week. Is it worth it? At the end, what are you losing in doing that? Of course, taking care of self, we all fly from one place to other, and we know that what is the first thing the air hostess comes and tells us, that we need to be taking care of ourselves first, and whenever the professional help is needed, that should not be avoided. And of course, there are two different things when we talk about relationships. People in general say that do not develop personal relationship at workplace. They can be distressing, they can be problematic, they can lead to a lot of problems, because when there are competing interests at workplace, and you are emotionally attached to your colleague, and he or she doesn't do the way you want to do things, or you think your interest is compromised, ultimately end up losing relationships. The other way to is always try to maintain cordial relationship with people at workplace, and maintain a relationship where you can do some amount of give and take in this, when you want to grow together. It's not that there's always a tendency that somebody who is senior always thinks that it's my right and the junior has to follow it. And at times juniors end up feeling that the senior is not allowing me to do things, he's stopping my progress. But it's not that. We all need to learn to give and take. And of course, at the same time, we need to also develop good relationship at our family. Again, the kind of having an attitude towards work, finding meaning in the work, enjoying your work, and limiting your working hours, having a control over your schedule is important, and always have a positive outlook about life, and identifying and acting on the values which you hold for yourself, and stressing the work-life balance becomes important as one of the life philosophy, that I'm not going to compromise my family life because of my work. At the end of the day, I'm saying this, we all are working in a government setup. Nobody can stop your salary, whether you're working or not. And the basic principle which works here, if you're doing more work, you'll be given more work. Somebody who's not doing anything will not be given work. That's the basic philosophy you need to remember, and you should try to keep away from that. Of course, if you are able to practice spirituality, and you think prayers, meditation, writing journal for yourself, showing gratitude to others helps, do follow that, and prioritize your work. Many times we end up doing things which do not carry any urgency or priority, and we waste a lot of time, and then later start having a lot of stress. And of course, when you're trying to practice priority, the principle of the so-called the Moscow method needs to be remembered, which is more important for the trainees to understand, that always start with the must do things, do them first, then should do things, then I could do things, and I won't do things. So if you make that list for yourself, for your work every day, you will end up doing things which are required, and will not enter into an interpersonal problem or a stressful situation in your life. So this is basically that I must have, should have, could have, and will not have. So that's, again, when I say in terms of prioritizing life. One is doing it, and second is having it. Again, building resilience, that having a realistic recognition, overcoming denial and those kind of cultures. How much time I have? 5 more minutes? That be okay? Yeah. So, of course, taking time away from the work. And when we try to talk about building resilience, again, basically we talk about how we start connecting ourselves with our work and how much we show our empathy, what level of work surge we have, how we deal with the politics, how we take a step back, what is our vision, perspective, and purpose in life. We need to follow that. And the personal characteristics which are going to help you out from the burnout is amount of humor you have, and how much adaptable you have, how much optimistic, confident you are at your workplace. So and you also need to have a strong management support, the team culture, and that's where we as clinicians, as consultants are responsible to make this so-called team culture with people where we are working, and the social support, of course, you have. All these three things will take care of whatever challenges you end up facing. So basically at the organizational level, when we talk about if we want to reduce the burnout, we need to talk about having a sustainable workload, that what workload a person can sustain. If somebody cannot sit in an OPD and see maybe 200 patients a day. So we need to understand that we need to cut down on the patient load, or we need to understand what is the optimal level of workload which a physician can take. Then we need to understand, and as at the organizational level, that there should be a lot of feeling of control and reward, that somebody who's working should be rewarded from a different perspective, and he should be recognized, and the reward is that the things which he is doing should be glorified, so that he feels motivated to do things. And we also need to create a sense of community, that we all grow together and move forward, and there should be a lot of fairness, respect, and justice at the workplace. And we have meaningful, and we value each other's work. So physicians should be provided lot of physician autonomy. When they are doing work, it's not that a junior student is working, the senior student is going to say, no, you are going to do this way only, or senior student is working and the consultant is going to say. If at one level you see that he or she has become competent enough to manage things, he should be given autonomy. And adequate support staff, which we know that how much support staff we have, and in institutes like ours or other government institutes, the support staff is minimal, so we need to work at that level. The organization should do that. And again, collegial working environment needs to be created, and we should value the medical profession, that the core part of the mission is very clear. We all need to understand how things are going to move, and we need to be focusing on taking care of people, moving towards more of excellence, working as a team to help our own community. And we should minimize the work-home interference. So flexibility of the child care and the scheduling can be done. Working hours can be rescheduled for people, those who require that kind of needs. And of course, ensuring vacation and not allowing people to do overtime and other things is again important, and providing adequate mentoring and allowing them to have periodical sabbatical from the workplace again helps. So this is just a summary of that. So at the organization level, again, we need to educate and increase awareness of people about physician burnout. Many people don't understand, don't recognize that. And we need to have a designated time for reflection. We often have faculty meeting, resident time meeting. So one of them can be converted into reflecting back how much we are feeling stressed at workplace, what we think are important, and we need to teach practical skills, how to deal with the burnout and build community, so that we are able to take care of each other. And of course, whenever the care, somebody requires mental health care, that needs to be provided, and mental health care should be organized in such a way that anybody can contact a mental health professional at the time of need. The 24-hour crisis helpline should be provided across all institutes. We have that service, so anybody is interested can always avail that. And of course, peer support is very important. In India, we all work, we all know the crab theory, that we all are, if we are put in a box and one crab is trying to go out, others are trying to pull him down rather than allowing him to go. So, but the reverse should be done, that we need to provide support to each other. So we often talk about when we interact that how are you, isn't it? That's where is the dictum. But as a psychiatrist, when we meet each other, we ask each other, how am I doing today? So where I ask my other colleague to tell me what does he think about me, whether I am fine or not. That's the culture we need to develop. Of course, we need to improve our workplace environment, that we need to review the work schedule and the workload, and we need to have an optimal workflow so that which is realistic, which is achievable in terms of patient care, documentation, and whatever the assistance is required. And we need to transform the institutional culture, and we need to have culture of wellness at the workplace and support the personal resilience strategies. So a positive work environment at the organization level also can have a lot of so-called protective factors, ensure job security, and provide the child care opportunities and maternity and paternity leaves and so on. What are the barriers why people don't seek help? This are some of the barriers which people talk about, that they lack time, they prefer to do self-management, and there is lack of convenient access to services, and there are a lot of concerns about the confidentiality and the stigma. This is what the Western literature suggests, so we need to understand this. And in terms of Indian data, again, we see that many physicians or the medical students don't seek help for their mental and physical health. And if you look at the basic reasons, again, in the Indian data also suggests that there is a lot of lack of time, fear of unwanted intervention, unsure about where to seek help, lack of confidentiality, stigma, cost, and other things. So at the institutional level, we need to emphasize these issues, that these barriers can be taken care of. And the data from our own institute again suggests that people don't seek help because of feeling stigmatized. And the basic common thing our residents come and say when they're seeking help from us, that my colleagues are going to think that I'm a weak person, I have a mental illness and so on, and they don't seek help. So that's where we need to understand that when one of our colleagues has a mental health issue, we should learn not to stigmatize him or not to pass derogatory remarks to them, so that they stop. Otherwise, what happens? They actually stop taking help further. And they often fear that they will be considered as somebody who's trying to slug away from his responsibility. And they always fear that what would be the impact of the help seeking on their career, and further what would be the attitude of the faculty, and of course the time constraint. So it's a request to everyone involved here, that we should learn not to stigmatize our colleagues who are going through stress and are seeking help. So the higher barriers to seek mental health care in our country, and this also prevents physicians despite having problems and despite the services are being available. So this is what is the new NMC guidelines, or the NMC has issued this notification. If you look at this, what does this read? And this is from the PG committee, that the PG medical students, how we need to change the environment, that by ensuring adequate rest, weekly offs, counseling for those who are under stress, arranging yoga sessions on regular basis, sanctioning leaves when required, and respecting their dignity by providing positive, conducive working environment. And a committee may be constituted to look into the complaints and grievances, including anonymous complaints, grievances which may be submitted by the PG students either through mail or received in a drop box specially placed for the purpose. And all medical colleges and institutes are therefore requested to take necessary steps for taking care of the mental health and well-being of the PG medical students studying and working with them. An action taken report also must be submitted. This is what is the most recent. This is about 2 weeks back. If you look at 10th of August is the date, is being issued by the NMC. So this issue is getting flagged now across the country, and we all as students, as teachers, should be aware of it, and we should all work together to fight out the physician burnout. So to conclude, physician burnout among doctors is a global phenomenon, and it leads to poor quality of care provided to the patient, increases medical errors, and poor retention of patient, in addition to the poor health outcomes. So how we can reduce? We need to enhance the resilience and the work engagement at the individual doctor level, and creating a positive work environment that helps the doctor to achieve a work-life balance and enjoy job security, and provide a family-friendly work environment that will prevent the burnout. Thank you.